Welcome to Let's Talk Lupus. Many parents with children that are diagnosed with lupus have questions, particularly, can my child attend school? Well, Dr. Levy is here to discuss that very question in this month's edition of Let's Talk Lupus.
School is really an integral part of life for children and adolescents. Not only is it important for the learning that takes place there, but the socialization that happens at school really is crucial for their development. While active lupus can lead to lots of symptoms including fatigue, joint pain, other mobility issues, concentration issues, memory issues, we fully 100% encourage school attendance for all of our patients. For someone who's been very ill and perhaps they were hospitalized, we would encourage a gradual return to school. Perhaps start with 1 hour a day, every day for the next 2 weeks, and then work up slowly so that eventually that child is back in school for the full day. So the healthcare team, we as part of the healthcare team, we're always willing to speak to the school. We write letters to the school. We make suggestions for accommodations that should be put into place. For example, we often would recommend that a child have some exemption from their gym activities for some period of time, or that they have permission to take longer to complete a test or to complete an assignment. Some children or teens, they don't want to tell their peers about their lupus. So we also provide some help in some ways that they can talk to their friends and talk to their teachers so that they don't have to pretend all the time that everything is okay. There are rare cases for some children who have significant neuropsychiatric lupus or CNS lupus, where we do suggest that a child or teen not return to school for some period of time. Usually it's several weeks, it could be several months. So for these individuals, we want the brain to have some time to rest and recover. Sort of akin to how when you have a broken bone, you put it in a cast so that it can recover without stressing it. The brain, similarly, sometimes it needs time to heal without having extra stress, like school, being put on it. This really, however, is the exception, not the rule, for most children and teens who have lupus. Because on the whole, there are many more benefits to attending school rather than not attending. The last concern that comes up sometimes is that families may be concerned that with all the medicine that they're taking, the immune suppressing medication, that the child is at risk of catching something or catching an infection when at school or around other children. So there's never going to be zero risk. There may be some small risk, but we believe that the risk is small. And especially right now when children are wearing masks at school, they're doing good hand hygiene, they're washing their hands frequently, the risk of getting any serious infection from a classmate really is quite small.